everyone. Suzette here with Johnston Health. Today we're going live with Dr. Dennis Coffer, the Medical Director of Johnston Health's Hospice Health Services. We'll give everyone a few minutes to join and then we'll get started. You been fishing lately?
No, I would like to get back and do some fishing. And my idea of fishing is sitting on a chair at the beach with a fishing rod and pretending to bring fish in when all I'm doing is behind my sunglasses, checking out the scenery.
Hmm. You're a watcher.
I'm a watcher.
I like watching other people catch fish.
No, what I do is I like to listen to podcasts while I'm sitting out there.
Oh.
It, it It's so neat. You put these headphones on, you can listen to anything while you're pretending to fish, feeding the birds.
All right, it looks like a few people have joined us, so we'll get started. Good afternoon, everyone. Welcome to Johnston Health's third Facebook Live event. Today, I'm thrilled to be joined by one of Johnston Health's finest, Dr. Dennis Coffer, who is the medical director of Johnston Health's Hospice Services. Tell us a little bit about yourself and your work with Johnston Health's SECU Hospice House.
You know, Suzette, after being a surgeon here since 1993, about 7 years ago, I realized that there was a place for me in hospice care. I came to hospice care from cancer care because you need to have a hospice service to adequately deliver cancer care. So for the last 7 years, I have been fortunate enough to be involved with the hospice service here, both at the hospice house and for the home service.
We're glad to have you with us today. For those of you who have just joined, we're speaking today with Dr. Dennis Coffer, who's the medical director of our Johnston Health Hospice Services. Hospice can be an incredibly helpful service to those of us who need a little extra help. But I'm not sure all of us know exactly what hospice is. Can you give us a definition of what hospice is?
Hospice care is a type of palliative care. Palliative care is care that is intended to relieve symptoms and to bring comfort as opposed to strictly fighting disease. Hospice care is specific palliative care for people who are near the end of their life. And it is a necessary care because for most of our history as human beings, people have faced the end of life alone, cold, in pain, and afraid. And what hospice care is able to do is alleviate those horrible feelings that are accompanying the end of life.
You know, I think we do plan for things like weddings and graduations and even our finances, but we don't do a very good job of planning for end of life, for that time in our lives when we cannot speak for ourselves. And I know that that's something that you're very passionate about, advanced directives. And as a matter of fact, we brought along a tool that you're a big fan of, and would love for you to talk a little bit about this and how you use it and what are your thoughts on it.
Fortunately, I don't use the five wishes very often, but I benefit from them. The five wishes are five areas that we would want to answer questions about when we aren't able to talk. When that time comes in our life, when we are too ill, when we are too medicated, when we're too pained to have a discussion about what we really want. Generally, these are referred to as advanced directives or living wills. And most people think about only the first of the first two of the five wishes. The first one being, if I can't speak, who speaks for me? This is usually referred to as the medical power of attorney. And as a provider of healthcare, I wish everybody had a medical power of attorney, and specifically only one. We would rather not have to deal with a committee when we ask, what would grandmom want right now for treatment? The second wish revolves around, do I want to be resuscitated? If my heart stops, if I have a terminal disease and I stop breathing and my heart stops, do I want my heart restarted? Do I want to have what we call CPR? Do I want to have a ventilator? These are the two areas that most people think about when they talk about end of life advanced directives. For me, the next three wishes are frankly much more interesting, if not clinically as important. The third wish is, how do I want to be cared for? Would I want to have massages? Do I want to be treated with warm towels, with creams, with oils? Do I want my hair combed? Do I want to have manicures? How do I want to be treated? The fourth wish is social. Do I want people to visit me? Are there maybe some people I don't want to come visit me? Do I want to have music? Or at least that's what us old folks used to say. Now I guess you say, do I have a playlist that I would want when I'm in bed and I can't ask for it? Do I want prayers? What kind of prayers do I want? Do I want a religious ceremony at end of life? Do I want to be buried? Do I want to be cremated? The fifth wish is, what do I want other people to know? And these are usually pretty straightforward. If I hurt you while I was living, please forgive me. If you hurt me, I've already forgiven you. And frankly, that applies for that article you ran about me 20 years ago. And the most interesting one to me is, if you're sitting at my bedside, you're here because you love me, as is everyone else. If you have differences with the people that are here in my room, put them aside out of your shared love for me so that my life can mean something. In brief, the five wishes are a book that you can read and get interesting thoughts about your own life. You can circle what you want, you can cross out what you don't want. If you get it notarized, it will serve as a legal document, and it is a marvelous gift to give someone you love so that if they have to make decisions for you, they never have to worry about it.
That's a great planning tool. That also leads to a question about, how do you visit when you go over to the hospice house? What tips do you have for when you go visit a loved one?
The important thing to recognize about hospice care is that we do not mourn the living. Our goals of care are comfort, grace, and dignity. We want everything for the people in hospice care to be as, for lack of a better word, joyful, pleasant, positive as possible. We want an atmosphere of joy to celebrate life. People think hospice is a place to go to die. I tend to think of it as, hospice is a place where you maximize your life until you die. So when you come, the idea is to share positive memories. Bring music that your loved one likes. For that matter, if there is a pet, bring the pet. All we require is veterinary clearance of no evidence of current disease and that the shots are up to date. And overwhelmingly, the pets we get are dogs. In 7.5 years, I have also seen one cat, one pot-bellied pig, and one horse. And no, we did not let the horse in the building. He walked around the outside and put his head through the windows, and everyone hugged his neck. And if that didn't make you cry, the fact that at another time we have had 2 weddings at the hospice house. It is a place of life.
That's wonderful. And I know one of the most important parts of the hospice house are the hospice volunteers. And even your wife, Gail, is a volunteer there. And I know she and Joan Kahn are what day do they volunteer? Tuesdays?
The Bobbsey twins are there on Thursdays.
Thursdays, yes.
Uh, The volunteers are both a necessary function of hospice because Medicare requires that 5% of our work be done by volunteers. At the same time, for the volunteers, it's an enormously gratifying job. The volunteers are brought into the program after a indoctrination or a teaching session, and they can find areas that fit them. Some volunteers don't care for hands-on patient care, not that they give care. I mean hands-on patient interaction. Other volunteers do clerical work, and there is lots of that. And other volunteers do bereavement, because part of what hospice is to take care of the family after death. And we follow up with our families to make sure that they have appropriate coping mechanisms, because after death is the time for mourning.
That's right. We have a staff that includes a social worker. We have a chaplain there. Am I leaving out anybody? I think
Well,
we actually have two.
we have two social
Mm-hmm.
workers, and there's always a chaplain available also. And the idea is comprehensive care and understanding that guaranteeing comfort for the patient also means that we're going to take care of their family. And that gives great comfort to the patients that are aware of it.
That's right. That's true. And we also have a volunteer coordinator, Wanda Johnston. If you would like to volunteer, you could definitely reach out to her. That information is on our website. There we go.
Cheers, everybody.
So as we've been talking, we've gotten a couple of questions, I think, from viewers. We'll take our first one here. Okay, what are some of the, let's see. So we just talked about that, about volunteers. What about tips for how, let's see, yes, during the pandemic, have friends and family members been allowed to visit at the hospice house?
The hospice house has been one of the few facilities that has allowed visitors throughout the pandemic. We have had restrictions. We only allow 2 patients in a room at a time, and while in the building, all visitors are expected to be masked. In the patient's room, they may remove their mask if there is no one with them from our staff. We now currently allow as many as 4 different people a day to visit, again with the restriction that it only be 2 people in the room at a time. And when it appears that death is imminent, we expand visitation under what we call a compassionate policy, and we will allow as many as 10 visitors, again only allowing 2 at a time in the room.
All right, that's good to know. Here's another question. How do I know when it is time to involve hospice?
Actually, that decision needs to come from a doctor. The process for coming into hospice is that 2 doctors have to agree that a person with a terminal illness is not likely to live 6 months without treatment. My job is to be the second doctor, and I act as an advocate for the patient. So if a doctor suggests that a patient has, say, cancer that is not likely to be treated and will end the patient's life, my job is to reassure the family, I've read the chart, I agree with that doctor, and I think that's appropriate. Once that doctor has informed the family of that, or the patient, they can then choose to have hospice services, and to get them, they have to call our office. And once they call our office at the hospice house, and the number will be posted somewhere for you all. If I just read it right now, it won't help. But it's 209-5100, area code 919-209-5100. We will get the process started for you. But first, we need to have a doctor tell the family that this is appropriate, and he orders the process to begin.
Okay, that's all good information. Is hospice only for elderly people?
There's no age restriction for hospice care. The only restriction is a life expectancy of less than 6 months. We have taken care of people in their late teens here in Smithfield. Um, Obviously, the great majority of our patients are much older, and we are happy to guide families if they have really young children that have unfortunate hospice necessities.
That's good to know. That's good to know. Also, I have a question too about pain management. I know pain is something that you, as the medical director there, help manage. What sorts of attitudes or things attitudes about pain control do you encounter, and what is your thoughts about that?
First and foremost, of the three goals we have, comfort, grace, and dignity, comfort is the first, and comfort means freedom from pain. There are holistic ways of dealing with pain that involve redirection or other types of activities. What you're asking about is specifically pain medications. As medical director, I don't have direct patient contact. However, I am also attending doctor for these patients. And as the attending doctor, my job is to make sure no one suffers. And we use a scaled pain ladder that we call it for pain that's rated 1 to 3, 4 to 6, and 7 to 10 with different medications. And what I can tell people is that I will 100% guarantee relief of pain, but there's a negotiation. And the negotiation is as you need more narcotics, there is inevitably more sedation from the medicine. And I need to negotiate with my patient how much relief they want versus how tired they want to feel. And that is strictly up to the patient. What we frequently hear is we don't want to start narcotics because we don't want to get addicted. And in hospice care, we don't worry at all about addiction. Addiction is a problem of dependency. Our problem is comfort, and we will absolutely make sure our patients are comfortable.
That's great. That's good to know. Do you have any tips for families looking into hospice care?
The biggest tip is call the number for the hospice house. We can give you the direct instructions on how to best navigate what's coming because, again, the family may feel that the patient needs hospice care, but their physician may not agree. And we have the method of getting in touch with the physician to interrogate them to see if there is a legitimate need for hospice, or for that matter, whether the patient only needs home health care without hospice. And lastly, whether they need hospice care at home or whether they can be taken care of in our facility.
Dr. Carper, thank you so much for joining us today. I know I learned a lot, and I hope everyone out there did too. If you enjoyed this conversation, please like and share this video with your friends. We'll be hosting more Facebook Live events like this in the future, so make sure you subscribe to Facebook Live notifications so you can join us again next time. Have a great day, everyone.